So on this video, we're going to go over the cranial nerves 10, 11, and 12. And so some of the objectives, it's to list the type of nerve fibers found in the cranial nerves. We're going to describe the location of the cranial nerve nuclei and describe the peripheral distribution and in general some of the functions. The clinical manifestations, I'm going to explain them on another video. And so here are the cranial nerves that we are going to discuss on this video. So we're going to talk about now the vagus nerve, cranial nerve number 10. And in this nerve, the function is a sensory and motor also. So for the sensory, it's going to go to the information. It's going to give you information from the organs. So here is some of the organs that it's giving you sensory information. And then the motor sends information to the organs. The origin, it's going to be, in the case of the sensory branches, going to come from the organs. And the motor innervation of the vagus nerve is going to be the medulla oblongata, which you can see right here. The foramen through which the vagus nerve passes through or by, it's going to be the jugular foramen, which you can see there labeled in blue. The destination of the sensory branches is going to be the autonomic centers of the medulla oblongata. The destination for the somatic motor branches is going to be the muscles of the palate and the tongue, as well as the pharynx. And the destination for the visceral motor is going to be the respiratory, cardiovascular, and digestive organs, as you can see here. Anatomy exams be like, identify this nerve. And I'm going to make a quick stop because if you are enjoying this video, please like, share, subscribe, and leave a comment if you have a question or a suggestion. All right, let's continue. The accessory nerve, it's cranial nerve number 11, and the function, it's typically motor. Here are your accessory nerves. And what they control, it's the sternocleidomastoid. It controls the trapezius muscle, as well as the palate, pharynx, and larynx, which I'm going to show to you in a minute. And then the origin, it's going to be the spinal cord and the medulla oblongata. And the foramen, it's going to be the jugular foramen, which you can see right there. So the accessory nerve has two branches. There's an internal branch and an external branch. So the destination for the internal branch is going to be the muscles of the palate, also the pharynx, which you can see here, and the muscles in the larynx. Meanwhile, the destination for the external branch of the accessory nerve, it's going to be the sternocleidomastoid, as I showed you earlier, and the trapezius muscles. Okay, so lastly, we have the hypoglossal nerves, cranial nerve number 12. This cranial nerve, the function, it's mainly motor, and it controls the tongue movement. Here is your hypoglossal nerve, or nerves. And the origin for this, it's the medulla oblongata, which you can observe right here in blue. The foramen, it's the hypoglossal canals, which I'm also going to show you in another view, but here you can see it from an inferior view. And the destination, like I said before, it's the tongue muscles. So on this superior view of the cranium, if I tilt it like that, you would look at the occipital bone, and there in blue is that hypoglossal canal. And if you want to learn more about this information, you can click on the card on top of this video or wait at the end to find more suggestions, because I have a full playlist on the nervous system that you can continue watching and learning more. And that is it for this video. Don't forget to subscribe, like, and share. And if you have any comments, questions, or suggestions, you can always comment on the comment section below. Thank you for watching. I'll see you next time. Bye.